This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Jeff Ratliff with the Neurology Podcast and Thomas Jefferson University. I'm here with Amy Kunchok from Cleveland Clinic. Amy is the editor of the newest journal to join the neurology family. The journal is called Neurology Open Access. We wanted to invite Amy here to talk about the journal and help introduce everyone to what they can expect and be on the lookout for. Amy, welcome to the podcast.
Thanks, Jeff.
So let's start with a pitch. As you're meeting colleagues, as they're hearing about this new journal that's out there, what are you telling them? What can neurologists and other journal readers come to find when they come check out Neurology Open Access?
So it has a similar scope to neurology. However, it will have a broader scope to publish both, on one hand, more preliminary, early stage or very niche research, as well as the ability to publish more later stage, more refined research. So the Neurology Journal, the main journal, receives a very high number of submissions, probably around 4,000 per year, of which only 10% can be accepted for publication. And those that are selected are usually those that are well developed, ready for implementation into clinical practice with a broad application to neurologists. However, there are many very high quality submissions to neurology that are important for neurology clinical practice and advancing neurology research. But these cannot all fit within the constraints of neurology. And these often end up in high quality subspecialty journals, such as stroke or the MS journal, epilepsy and movement disorders, etc. So we recognise that our neurology readership and authorship needed a larger platform to be able to publish a broader range of neurology clinical research. So some examples of, say, early stage preliminary or niche focused research could include studies that have smaller cohorts or exploratory analyses such as advanced imaging or fluid biomarkers, perhaps proteomics, metabolomics, or exploratory associations or outcome measures that need further validation. On the opposite hand, the broader range of submissions could include later stage or more refined research. So this might be studies that extend upon existing knowledge but are still important for clinical practice. This might be post hoc analyses from clinical trials of secondary outcomes or large observational studies from data registries or large epidemiological studies. So that's the general scope of Neurology Open Access.
I think that's perfect. And if we're thinking about the vision and the mission with this journal, and as we've mentioned, you're joining this established cohort of journals. There's obviously the flagship Green Journal Neurology, Neurology Genetics, Neurology Clinical Practice, Neuroimmunology and Neuroinflammation, Neurology Education. And so in the conversations that you were a part of that we're discussing the launch of Neurology Open Access to add it to that collection. What are you and the rest of the editorial team looking to add to that landscape? Is it that broader spectrum and filling in at maybe some of the earlier stage trials as well as some of the more maybe post hoc or more refined niche trials? And what else does this add to this broader collection of neurology journals we already have?
So in addition to that broader scope that I described, I think the other way to think about the place of this journal in amongst the family are that, of course, we have the main journal, the Green Journal, and then we have two other journals that are really focused on the master clinician and master educator, and that would be Neurology Clinical Practice for the master clinician readership and Neurology Education for the master educator readership. And we then, of course, have the two very basic science-focused or niche journals, Neurology Genetics and Neurology Neuroimmunology and Neuroinflammation, which are very much defined by their subject matter. So I would envision that Neurology Open Access encompasses a open access journal for neurologists that are producing clinical research. So this may be clinician scientists or clinician researchers, or also called clinician scholars within various academic tracks. So it fits that the neurologist that is looking for a space to publish their clinical research that wouldn't necessarily fit within either the education or the clinical practice zone, and is also outside of the basic science focus of genetics and neuroimmunology and neuroinflammation.
I'm hoping you can teach us a little bit about open access and how that is going to complement what the neurology family has already been working under from a publications model standpoint.
Yeah, so open access is a really important tenet for open science. And open access means that people can log in and access the papers anywhere in the world without needing a paid subscription or an institution login or library permission. So this enables people anywhere to have access. So in addition to improving accessibility to neurology clinical research, it also means that for the authors, it extends the reach of their research to people everywhere. And these papers are more likely to be cited than the papers that are not open access. So the result of this for both authors and for readers is greater accessibility, but also greater reach of the research. And I think this is an important space. Open access is now emerging for clinician researchers because it's now mandated by several funding bodies, such as the Wellcome Trust and the NIH, that funded research get published in open access journals. And this is to increase the visibility, the accessibility, and the impact, but as well as to foster accountability for that funded research.
If we talk a little bit about some of the logistics of publication and distribution, what can readers come to expect? Will this be a print journal? Is it online only? How would you advise anyone who wants to try to connect with the content that you have already started publishing and are going to continue publishing?
This is an online content-only journal, and this is similar to the other journals within the neurology family, such as neuroimmunology and neuroinflammation, neurology genetics, and neurology education. So in a similar format, it will be available online on the Neurology Journal website. So please log into the website to check out the articles. You can also sign up for email alerts to receive a table of contents. And I think it's also important to highlight that all the papers will be ultimately searchable within PubMed in the long term. There is a delay when a new journal starts and there's a process to register the journal, so there will be a delay. However, we anticipate that all articles will be listed by early 2026 and ultimately all will be available to be searched on PubMed.
Are there any article types that are going to be perhaps unique to Neurology Open Access or certain formats that readers are not going to find in some of the other neurology family of journals?
Yeah, because Neurology Open Access is really aiming to offer a platform for clinician scholars and clinician researchers to publish, we're uniquely going to offer clinical trial protocol papers to be published in open access. And this is a really important article type for transparency for studies. Enables authors to share their protocol, their planned goals, their study design, methods and analyses that are planned. And it can prevent selective reporting of results. It promotes reproducibility and, again, accountability. And further, for the authors, this is an opportunity to bring greater visibility to their study and engagement from the neurological community and might even prompt referrals for participation in trials.
And so we've been talking about the journal, and I realize that we are post-online launch, if I have that correct. And so anyone who's listening right now can log on, they can find articles. So maybe it's unfair of me to ask you to pick, but I'm hoping that you could perhaps consider highlighting one or two of the papers that are available now that you think might be a good example for readers to log on, check out, and either one, it's going to hook them to coming back in for more, or maybe they are that type of article that's going to be a little bit unique to the journal that can give them a little taste of what to expect going forward.
Just to mention, we've started publishing a few papers online already, although our official launch is coming up at AAN in April. And so readers can look forward to seeing more papers coming online in April. We do have a few papers up already online. One of our papers I might highlight is cognitive progression independent of relapse and MRI activity in MS, and somewhat early stage research. It was a novel topic of progression of disability in patients of MS that's usually often measured in a physical measure. So there's a concept of progression independent of relapse and MRI activity that is predominantly measured usually physically, but in this study they used cognitive measures and highlighted that patients with MS can have a cognitive progression of disability that's independent of relapses. So this is a good example of a novel early stage study that was published as a clinical and scientific note. We also have a paper up online at the moment that's a good example of a very niche focus. This is titled Mammillary Body and Hippocampal Injury After Acute Perinatal Arterial Ischemic Stroke, where 130 neonates had an MRI at a median of 5 days after birth for arterial stroke. And it was a very nice paper that uniquely shows anatomical involvement on MRI of perinatal stroke, and in particular highlights bilateral mammillary artery injury that was observed. And I think that this is an example where Neurology Open Access strives to publish unique niche populations, good quality research, but quite narrow in its focus.
And so to finish us up, if we zoom out, and I will say one of our goals with the podcast, and even since the podcast was founded, is to really try our listeners be better neurologists and to serve neurologists. And so if I were to turn that charge to you, and in your role as a leader and editor of Neurology Open Access, how are you hoping that this journal is going to help serve neurologists who read articles to learn and to access the content that you are all providing?
I think that this new journal offers an opportunity for both authors and readers. For authors, it offers a great opportunity to have an open access portal within a very well-established family of neurology journals. So clinicians, scholars and researchers can publish their important research in an open access forum. And I think for readers, it offers an opportunity to have access. That's the core value of open access, is that people anywhere, neurologists anywhere in the world, can have access to this high quality research.
I'm glad that we're maintaining that value and making sure that this work is accessible to many and immediately. I've been speaking with Amy Kunchok. Amy is from the Cleveland Clinic and is the editor of Neurology Open Access, the newest journal in the neurology family. Check out the journal online and do read some of the journal's early publications that Amy and her team have been working to review and publish for our readership. And for those who are attending the AAN annual meeting this week in San Diego, you can find more information about Neurology Open Access as well as the rest of the neurology family of journals at the Green Journal Publications booth.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.